Good to go. Okay, welcome to this hybrid meeting of the Integrated Joint Board. I would remind all attendees that this meeting is being recorded and webcast live on the Council's YouTube channel. I have agreed the attendance of some members remotely and would remind all remote attendees to mute their microphones when not speaking. For any members of the public watching, please note that all the public committee reports, including details of specific recommendations, are available on the Council's website. I'm conscious we've got a few people that do need to leave at 4 o'clock, so I don't know what the biggest challenge will be today, me chairing the meeting to finish at 4 or Scotland getting a result against Brazil tonight. We'll see. Okay, so item 1, apologies.
Thank you, Chair. We have apologies from Martin Black, Kirsty Lee and Hayley Mears.
Thank you. Declarations of interest and statements of transparency. Okay, thank you. That takes us on to item 3A, the previous meeting minute. Can I submit this for approval as a correct record? Yep. Do I need a proposer and a seconder? No, that's fine. Thank you. It takes us on to item 3B, action log. Do we agree to note? Yeah, brilliant. Item 3C, the special meeting, submit for approval as a correct record. Again, everybody content? Yep. Yeah. Okay, so that takes us on to item 3D, which is the minute of the audit committee. Again, do we agree to note? Yep. Brilliant, thank you. Okay, item 4, exclusion of public and press. The Angus Integration Joint Board is asked to consider in terms of the board's standing order 11.2 whether the public and press should be excluded during consideration of item 21 so as to avoid the disclosure of information which is exempt in terms of part 1 of Schedule 7A of the Local Government Scotland Act 1973. Do we agree to exclude public and press? Agreed. Excellent. Okay, thank you. Okay, I'm going to kind of just change the agenda slightly. We've got Dave Berry on who, if we could take the palliative care item next, and I'll hand over to Dave.
Okay, thank you, Chair, and thanks for the opportunity to address the IGB today. So you have with you today the Tayside Palliative Care Matters for All strategy. For those who don't know me, I'm Dave Berry, Chief Officer for Dundee Integration Joint Board. I'm also, from an NHS Tayside perspective, the executive lead for the delivery of what was our corporate objective for 2025-6 for NHS Tayside around developing a local palliative care strategy. So Dundee is also the lead partner for specialist palliative care, although the strategy is much wider than that. It covers a range of services across Tayside. So in terms of the strategy you have in front of you today, we are setting out a shared vision for palliative care across Tayside for people of all ages that are living with life-shortening conditions, those that are dying and those who are bereaved. The strategy aims to ensure that we have the right care at the right time, right place, with the right people, the right experience and the right outcome. It's looking to build stronger, better connected communities and services, and the support to be grounded in what matters most to individuals and families. So the strategy builds on the Scottish Government's national framework, Palliative Care Matters for All, which was actually launched in Tayside back in September. So the strategy is needed because of a number of different elements. You all know we've got an ageing population. Across Tayside, the number of people aged 75 plus will increase by 24% by 2028. There's growing complexity, so more people are living longer with multiple long-term conditions, including frailty and dementia. Unfortunately, there's a rising need in children and young people, so 450 to 500 local children or young people live with life-limiting conditions. And the whole issue around inequalities, so people in the most deprived areas experience significantly poorer health and lower life expectancy. So the strategy is aimed to kind of really kind of respond to kind of a number of those challenges. And it sets out a vision where people with life-shortening conditions live as well as possible and receive compassionate, coordinated support, with the aim to enable people in communities and strengthen palliative care. The national strategy sets out 8 priority outcomes around palliative care, and we've kind of reflected in the Tayside strategy each of those outcomes, where we are now in terms of a system, and what we aim to do next to improve and deliver on the aims and vision of the national and local strategy. This strategy has been a kind of whole system approach. So the strategy has been delivered by a Tayside-wide palliative care steering group. That's had representatives from each of the health and social care partnerships, the acute sector, services, charities, third parties, hospices, and also with our third sector and care home partners in mind. And we've also kind of used the Tayside Palliative and End of Life Care Managed Care Network, which includes lived experience, to kind of sense check as we've gone through each stage of the development of the strategy. In terms of once this is approved, so this is the third IGB of the day. This paper has been taken to its NHS board tomorrow. It was also approved by the Population Health Committee of NHS Tayside a couple of weeks ago. There'll be a public-facing and more easy-read version of the strategy to be developed, given the importance of the messaging to the public. That'll be issued kind of shortly. And in addition to that, a more detailed delivery plan is being developed just now, and there'll be a timescale of August 2026 for us to deliver on that. So I'll leave it at that, and I'll let anybody else any questions.
Yeah, Jill, do you want to come in?
Yeah, thanks. And just to express support for the work that's been undertaken in relation to the development of the primary care strategy, and give Angus IGB the assurance around the involvement of Angus Health and Social Care Partnership in the development of that throughout the whole process. So I think really pleased to see the strategy being brought forward today. I think it really provides that clear strategic framework and a shared set of ambitions for palliative care and end-of-life care across Tayside. So thank you, Dave, on behalf of Angus Health and Social Care Partnership, for all your work and the team to bring it to this point. Thank you, Chair.
Thank you. Have we got any? Sam?
Thanks, Dave. Dave, as you know, as a non-executive, I sat on for the corporate objective, so it's good to see it finished. My question, which you've partially answered, was the supported through the dedicated palliative care delivery plan and the timescale for that. But I think you've said, is it August you're hoping to have that finished by?
Yeah, so that's been worked on. So I can hear the echo in the that's been worked on as we've kind of been developing the strategy itself. So yes, we've got a timescale of August to kind of refine that and publish that particular delivery plan.
Any other questions? A couple of quick things from me, Dave, just in terms of the key indicators. Will they be coming back in August as well, or will they be developed over a longer time frame? And then also talks about digital innovation. I just wondered if you'd give us a bit of a flavour what that might look like.
Yeah, thanks, Chair. So the performance indicators themselves won't be available at the same time. We're working kind of across with the Scottish Government around that, because currently there aren't any indicators. There were no indicators developed as part of the strategy itself, but work was continuing with Scottish Government and partnerships to develop that. So there are some good models that have been worked on just now. Our steering group heard from Highland, who are kind of quite far ahead in terms of developing. So we're kind of aligning with some of the work around there, but it won't be ready for August. But obviously, it's a key part of a measure of the success of the strategy around that. In terms of digital, it's the same. I suppose the same as most of our services. We're looking at the sort of digital opportunities, whether that's around information and access to the right resources for people affected by either bereavement care around dying, long-term conditions, and also how we better use digital and technology within the specific service provision that we can make. So there's some work around that in terms of exploring that further, and that will be kind of set out in due course once we have a kind of clear direction on that.
Okay, thanks, Dave. Any other? Yeah, Andrew.
Yep, thank you, Chair, and thank you, Dave, for presenting this. Certainly very much welcome this palliative care strategy. As is highlighted within the strategy, the importance of this is just escalating year on year as the burden of palliative care within our community, aligned with the increasing age of our population, just increases. So I'm keen to see, I'm aware of a relatively static stroke sort of possibly reducing resource framework to support palliative care across Tayside, both community and specialist. And certainly I'd be keen for the delivery plan to address the issues that poses in terms of an increasing need and yet a static or dwindling resource to support that. I also very much welcome within the strategy just this alignment with existing community services, so that actually we're not sort of doing something to, we're doing something with throughout this document, and that's very much welcome.
Yes, Alison.
Just to provide some assurance, Andrew, that absolutely we will be looking in Angus to be aligning it with our existing services. We have our strategic framework, and we will be looking to make sure that the actions for palliative care in Angus align with the Tayside palliative care strategy. They also align with our strategic delivery plans within the strategic framework. An example would be future care planning. For example, we put that as a main topic of our prevention proactive care programme, but we will be aligning, and we are regularly in contact with the programme support for palliative care at the same time to make sure that we're not duplicating and we're working synergistically.
Yeah, no, thanks for that, Alison and Andrew. Are we happy to approve the recommendation per the report? Okay, Dave, thank you very much, and I think that's all 3 IJBs you've been to today, so you've got a cracking hat trick. I just hope John McGinn gets a similar hat trick tonight. So, cheers, Dave. Thank you.
Thank you, Chair.
Back to the item 5, the service user story, and it's Karen.
Thank you, Chair, and thank you all for inviting me along today to celebrate our volunteers across Tayside and Angus. Week beginning the 1st of June this year marked National Volunteers Week, and I'm looking at Sam because I know he was there for the celebrations, and events were held across Tayside to celebrate and recognise the contributions of our volunteers to NHS Tayside and also the Health and Social Care Partnerships. At each of these events, long service and milestone awards were presented. There was around 160 awards presented across Tayside, and for Angus we had 27 individuals who received these awards. Just to give you a flavour, we had 19 people receive a 1-year award, a 3-year award, 3 people got 5+ year awards, 1 had a 10+ year award, and 1 15+ year award. So I hope that helps outline the stick-with-itness that our volunteers have in providing services. I'd like to give a special mention at this meeting that there was actually a 45-year award given at one of the Tayside events for Margaret McLennan, who is a flower arranger in Roxburgh House and has done that, as you can see, for many years. So across Tayside we have around 500 active volunteers who complement the work of our staff in providing that added extra for our patients and service users across the area. Volunteers come to us to give something back, to learn new skills, to meet new people, and we're really grateful to all the volunteers who give their time freely to help our patients, service users and staff. Locally across Angus, our volunteers make an incredible difference every day through a wide range of roles that touch the lives of people throughout our communities. They support people by helping hospital appointments run smoothly, spend time visiting those on wards who have few visitors, read to patients, provide hand massages, and drive adults to appointments and day services. They also support children and families across Angus, helping young people stay engaged in school and assisting with family contact sessions. Their impact reaches even further into our communities. Our volunteers help with prescription runs, support wellbeing cafes by preparing meals and sandwiches, take part in local walk and talk sessions within our recovery communities, and provide vital support for people who use hearing aids through the 17 clinics that they provide every month, repairing hearing aids, supplying batteries, and lending an ear, pardon the pun, to those people coming in to the service. Together, our volunteers contribute an incredible 1,900 hours on average each month, just in Angus alone. Their dedication, kindness and commitment to support others and inspiring is something we are immensely proud of within our volunteer services. Each volunteer gives their time, energy and compassion selflessly, and their generosity helps strengthen communities, changes lives, and acts as a reminder of the power of people helping people. I've sat here now and given you a lot of facts and figures, but I thought it would be pertinent to finish by sharing some personal stories from our volunteers. 2 volunteers have kindly agreed to share their stories with you today. First of all, I'd like to bring you A's story. So his story, this is his own words. So before starting volunteering, I'd been in recovery from a drug addiction that took up most of my late teens and into my early 30s. I've now been in recovery for well over a decade, but had years of struggling to leave the house alone and reoccurring mental health issues around anxiety and depression. I was diagnosed with complex PTSD in my late 20s and struggled with it during and after my drug addiction. I slowly started attending the wellbeing cafes with a key worker from ADARS a good few years ago now, and got involved in the walk they held every Tuesday morning. I then started regularly attending the wellbeing cafes afterwards. I was discharged from ADARS a few years ago now, but decided to still attend the walks and wellbeing cafe on a Tuesday. This led to an opportunity to do peer support through Tayside Council on Alcohol and walk leader training through Angus Health and Social Care Partnership, which I accepted and completed in 2025. I was then asked to take over the Tuesday morning walks, which I was happy to do as I'd had a lot of experience already due to attending the walks regularly and getting to know the people involved. I also attended the Wellbeing Cafe and sometimes gave some peer support and signposting to people who asked for my help. I find it's mostly people who know me back in my years of addiction who approach me for advice, due to them knowing I have lived experience and managed to beat my addiction. I find the walking group rewarding, as even though attendance can be hit or miss, I have a couple of regulars who I've seen going from being socially isolated and struggling in social situations to now chatting away and getting back out and about. It's really good to see someone coming out of their shell and recovering from issues they were struggling with before coming on the recovery walks. I also understand the struggles they have, as I've experienced similar things myself, and I always try to use my lived experience to show them that things can be better with time. Volunteering has also helped me to manage my complex PTSD symptoms and social anxiety to a great extent. It gives me a sense of achievement when I see clients doing well and thriving, as I've known I've played a small part in helping them. Volunteering has given me confidence that I can actually achieve new things. I've gone from being unable to manage social situations to leading walking groups and doing very limited peer support. It's also given me a push that I need to try new things within the community. So next volunteer B story is completely different. So I think I wanted to give you a flavour of the breadth of volunteers that we have across Angus. So after leaving the RAF with 37 years service, I decided to retire. but I soon found I needed to do something to get me into a routine that could benefit people who were in need of help. I didn't know what area to volunteer in. However, I met with a few people in Carnoustie who spoke to me about the types of organisations that would be glad of my support. I was informed of volunteer driving, and I decided to contact the office, which, if anybody's thinking about volunteering, is currently based in the library on Forfar High Street, and offer my services. After an interview, recruitment and attending a course, my journey began. I've now been doing this for over 13 years, and I still get a really good feeling of helping others. Volunteering gives me a reason to get up in the morning. I'm getting to help others who need support, and also their families, by driving them to areas they would not be able to get to without my help. Also, there are some characters and their life stories are fascinating and bring a smile to my face. The sad part to this is when you have been driving someone for a long period of time and the person sadly passes away or ends up in care, especially when you formed a friendship with them and the family. I hope I'm able to contribute as a volunteer for many years to come yet, as if I needed to help, I hope my family could get access to the service that all these drivers provide to this area. I'd also now like to share with you, if you just allow me a few more moments, Karen's story. So Karen uses the volunteer service. So she says, I wanted to send a message of thanks to all of your volunteer drivers and ask that it be shared at your annual meeting. It was shared at our annual meeting, and I'm bringing it along to the IGB today because I felt it was really important. As someone who relies on your service, I honestly don't think I can put into words just how valuable it has been to me. Getting to medical appointments might sound very simple, but when you've spent a lifetime being unwell, feeling anxious about healthcare appointments and trying to navigate a complicated system, it can feel like climbing a mountain before you've even left the house. Your volunteer drivers have helped me climb that mountain. Not only have they got me safely from A to B, they have helped keep me calm, listened when I was nervous, shared their own stories, and reminded me that there are still genuinely kind people in the world. I've enjoyed meeting every one of them, the conversations, the laughs, the life stories. And yes, occasionally the banter has been questionable, but every journey has left me feeling a little lighter than when I got in the car. What amazes me most is that these volunteers give up their own time to do this. Navigating hospital car parks is enough to test the patience of a saint at the best of times, yet they do it with kindness, humour, and without asking for anything in return. Without this service, I genuinely would not have been able to attend many of the appointments that have helped me get answers, regain some strength, and maintain my independence. Of all the support services I have received over the years, this has been one of the most important and practical to me. Healthcare often focuses on doctors, nurses, and treatments, but sometimes it is the person who gets you through the door that makes all the difference. Please let every volunteer know that their efforts are noticed, appreciated, and valued more than they probably realise. They may think they're just giving someone a lift, but they're often providing reassurance, companionship, confidence, and hope along the way. In her eyes, they're all a bit like angels in disguise, and she's fairly certain they've earned themselves a few extra brownie points at the pearly gates. And she just wanted to reach out and say thank you for everything that they do. So thank you for listening to me today to bring these stories to you. I'd like to ask that you join us in celebrating the selfless contribution our volunteers make across Angus and the difference they make every day to people's lives and contributing to the delivery of our strategic objectives. Thank you.
Thanks, Karen. I've said this before, I've always found these sessions really powerful, and I think what I've taken from today is just not just what the volunteers give to patients, but what the volunteers get from actually volunteering. It's a double-edged sword, if that's the right expression. But yeah, thank you very much. Any comments?
Yeah, just as Karen said, the reason I had the pleasure of attending the session for Angus, and I was asked to read out that message. It really was, it makes you realise how much goes on. And we were, Tom, the chair of NHS, joined us for that as well. So we had a great, and just when you're sitting down afterwards and just chatting to these people, you realise how much they do, and so it is invaluable. Thank you.
Okay, any other comments? Okay, thank you, Karen. If you can pass on our thanks to everybody that contributed, it was greatly appreciated and very, very powerful, so thank you. Okay, so that takes us on to item 6, Chair and Chief Officer update, and Jill.
Yeah, thank you, Chair. So I won't go through the report in detail, just to pull out a couple of things. Obviously, Karen has been here to share the support and the feedback from Volunteers Week, but also just to acknowledge it has been Carers Week as well. So in addition to the volunteers, I think it would be good to take a moment to acknowledge the work that and the contribution that unpaid carers also provide across Angus and indeed across Tayside. I think every day carers provide practical support, emotional reassurance and advocacy and love to family members and friends, often balancing caring responsibilities alongside work, family life and other commitments. I think the value, and I do speak from a personal perspective as well, I think the value that carers bring can't be overstated. They help people remain independent, maintain dignity, stay connected with people in places that matter most to them, and their contribution is fundamental to the sustainability of our health and care system, but importantly it's fundamental to the lives that people care for. And we recognise the challenges that carers face and remain really committed to ensuring that carers' voices are heard and that they receive the support they need to maintain their own health and well-being also. So I think just on behalf of both the partnership and the IGB, just offering thanks to carers and volunteers during specifically the weeks of recognition, but all year round for all that they do to support how we provide and deliver services as well. Just to pull out on daycare, I think John's going to pick up on that, and then I've got one final point just to raise, Chair, if that's okay.
Thank you, Jill. Good afternoon, everyone. So, you'll note the daycare day opportunities update on page 24 within Jill's report. So, I suppose just to put some narrative on top of this as well, as by means of an update, I can confirm that I've had contact with Hayley Mearns from VAA and also a meeting with daycare providers this week, and there has been a lot of work undertaken and progressed with VAA alongside our daycare providers. You'll note within the report that we touch on a cost of care calculator. So that has been developed collaboratively between VAA and the daycare providers, with some initial testing that has been carried out by the providers. And after a good discussion with providers this week, the next steps will be to complete the work of that care calculator, and then following this, restart the contract monitoring from the partnership's perspective, with further support from VAA to providers to develop financial sustainability models going forward. So the work is progressing well.
Thank you, John. I think June has been a month of weeks, and I think we also need to recognise that this week itself is National Wellbeing Week. So just to provide an important opportunity to acknowledge and thank colleagues across the Health and Social Care Partnership and our partner organisations that we work with, who work really tirelessly every day to support the people of Angus. Our staff are absolutely undoubtedly our greatest asset and richest resource. Their dedication, compassion, professionalism and commitment to continue to help us make a difference to the lives of individuals, families and communities, often in quite challenging circumstances and under pressure. So again, just on behalf of the partnership and the IGB, just to express thanks to and appreciation to all of our staff and volunteers and partners for everything that they do to care for and support the people of Angus, and that we will continue to support staff well-being as an absolute critical and important element to everything that we do to ensure that people feel valued, supported and able to thrive at work. Thank you, Chair.
Thanks, Jill, and I would echo everything you just said there. Open up for Dave, yes.
If I could just come back on John's update, can I just be clear on two matters? One is when this issue was last discussed, there was an issue in relation to £100,000 of savings, which was well, by the end of the conversation, it was notionally in the budget. And I suppose I'm asking at this stage for an assurance that no decision or action would be taken on that until such time as this work's completed, and we do have available to us the conclusion of this work. And also would like a second assurance, which is there was a request at that stage for an impact assessment in relation to carers, which wasn't available at that time and was to be part of the work, and we'd want that to come back before any final decision has been made, because developing the full cost of, until that's done, then the scale of the financial position won't be known. So.
Yeah, Joe. Thank you, Dave. Yep, so in terms of the first question around the savings, so yes, those were indicative targets, and the work is to help progress to a point where we understand fully the costs of daycare, and obviously Haley and VAA have been tasked with taking that work forward, so there won't be any decision made until we have that work completed. As highlighted within the update as well, VAA will obviously be providing ongoing support to daycare providers as well to ensure that they have got a financially sustainable model built into the work that they do going forwards. And the true cost of care calculator really needs to be undertaken for us before we can begin to take any of that forward. In relation to the second point, Dave, around the impact on carers, so again, this will come through that work with the cost of care calculator. It's really looking at all aspects of daycare, so we recognise that daycare provides a service to service users who attend the buildings, but it also provides an important respite option for carers within Angus as well. So the full cost of care will take all of that into account going forwards.
Thank you. Just respond to that. One of the things which was to be done, which John hasn't referenced, and I'm sure it is there, but we'd want to see, was that there was a reference in October to not using old data, but using current activity data as part of this exercise. And I see that as being quite key to moving towards developing the impact assessment to know the nature of that, so that it's not just the cost element. There are volumes and nature of provision fields that need to be filled out as well. And Jill is nodding, so I'm glad of that. Thank you. I appreciate that.
Lewis.
Yeah, thank you. Yeah, just on the daycare, you've obviously provided a response, John, but can we just have assurances that once the true cost of care is worked out and identified, if indeed those daycare providers have really been struggling on and not been adequately funded, will we get assurances that that funding will follow that matches what the kind of, I guess, the demand and the numbers of people that are using those services?
Thanks, Lois. So yes, what we need to understand through daycare, and we've had a number of discussions around this which have led us to this point, is to ascertain exactly based on the data that we have, what is the level of needs, and it's quite a broad spectrum of needs within daycare. The work that Haley's undertaken, and even through recent discussions with daycare providers, they have highlighted that they are working with a number of individuals who self-fund. They're also working with a number of individuals who are there as part of an agreed financial package whose needs require personal care. So there's a broad spectrum of needs. As we work going forward, we obviously use Scottish Government eligibility criteria to make sure that we're providing care aligned to needs that are assessed. And part of that will be to ensure that our funding is linked to those needs that we will provide support for. VAA are then obviously going to be providing continued support to providers to look at how they can ensure additional financial sustainability, so accessing various grant funding options and VAA as the third sector interface to support that financial sustainability going forward, so that it's very much still a partnership approach between the partnership and daycare providers, providing care and support for those that we will fund through SDS, but also providers looking at how they can enhance their models of care and consider other funding streams as well to create a more sustainable model going forward.
Thank you, Chair. Thank you, John. Just to follow up with regards to that bit of work, can we just get some assurances? Will a follow-up report be brought back on this that provides us detail with regards to the true cost of daycare?
So I think we're happy to work through what will come back. So obviously we need to link it in with our kind of financial planning and the strategic financial plan, but also conscious that it's been quite a long-standing item from an IGB perspective, so happy to look at what we would bring back from an assurance perspective. May not be a decision perspective, but happy to bring something back at some point.
Yeah, thank you. I think kind of a long-standing, ongoing project, and I think that's why it would be really good that actually, as an IGB, we can see that right through and actually know what the conclusion was and where we're at. That would be really helpful. I do have some concerns around kind of the expectation that those daycare providers would, not that they would look at their funding model, but I guess the reality is in terms of applying for funding externally, that provides job uncertainty, especially if you're looking to fund what often is the biggest cost, which is staffing. We know that the daycare providers have, often very experienced, skilled staff. And so if it was a position where they were having to look for funding year on year or every 3 years, if at best, I think that would be a concern, because we know that external funders often don't fund staffing, or certainly not on an ongoing basis.
Thanks, Lois. If there's nothing else, are we happy to approve recommendation for the... Oh, yeah, sorry.
Thanks. It's just a query regarding vacant beds and available beds. So within 3.2.2 and 3.4.2 suggests we'll have 763 service users and there are 20 vacant beds. But within 3.4.2 it states there 28 care homes, 25 are independent, represents approximately 1,053 available beds. So we're saying we've only got 20 vacant beds, but by their calculations, you're looking at 290 beds. So just a query in terms of that part. Thanks.
Thanks, Ron.
Thanks, Ron. Yep, I'm just looking at the section, so 3.22, yep. Okay. So, Ron, sorry, can you repeat the question in terms of was there a gap between, because obviously we've got 20 vacant beds reported to the partnership across care and nursing homes, looking at the respite beds. What was the angle, or what was the query you had? Apologies.
So within 3.4.2, they're saying that we've got 28 care homes in Angus, of which 25 are independent. This represents approximately 1,053 available beds. So in one part, we're saying we've got 20 available, but by that calculation, because we've got 763 service users, you're looking at 290 available beds in.
Thanks, Ron. So, yeah, there'll be elements of self-funders through beds as well. And I think what that's highlighting is it's highlighting the whole cohort across the board. So it's an overall figure. But happy to kind of have conversations afterwards to seek clarity on those points, if that's helpful.
Okay, so agreed recommendation per the report. Brilliant, thank you. That takes us on to item 7, the IJB Strategic Framework 26 to 36. And yourself, Joe.
Thank you, Chair. So quite a large paper with some large documents in that. So this report presents the refreshed Angus IGB strategic framework for 26 to 36 for approval, and represents quite a significant milestone for us in terms of setting that longer term strategic direction for health and social care services across Angus. It's being developed following a comprehensive review of our previous plans and what we have heard from the consultation and engagement to refresh to bring to the members' packs today in terms of the 10-year plan. You'll see that the overarching ambition remains unchanged, and the framework provides hopefully a clearer and more focused approach around two core priorities: prevention and proactive care, and care closer to home. These priorities are also supported by strategic plans, which are also in the pack today for approval. There is also a refreshed strategic needs assessment, market facilitation statement and housing contribution statement, and all of those together provide a comprehensive framework for delivery. The framework reflects what we've consistently told, what people have told us what matters most to them. Services are accessible, they're joined up and delivered as close to home as possible, and focused on supporting early intervention, prevention and care at home. It recognises the significant financial and workforce challenges, as well as the demographic challenges that we face as a future, and the need to fundamentally shift our focus towards or continue to drive forward the work that we are already doing around prevention and proactive care and the development of community-based models if we are to remain sustainable within the future. So the key ask for the board today is to approve the framework and supporting documents and issue the accompanying direction to both Angus Council and NHS Tayside, and that will formally establish the strategic framework for the delegated functions over this period and provide the basis for delivery, performance and monitoring arrangements going forward. I think just before I finish, I think just to pass on thanks to Sally, who did play a huge role in the development of this plan, and who retired in March. It would be absolutely remiss of me not to mention the work that Sally put into pulling this together. So thanks to Sally.
Thanks, Joe. Yep, and very comprehensive. Questions, comments? Yes, Chris.
Thanks, Chair. Thanks for the report, Jill. One of the things that I've brought to the board in the past is around insourcing, and you know the report there talks of a market facilitation agreement, etc., and working with external providers. But once again, we're not seeing any consideration in any form of insourcing back in to the local authority. And it's something we've discussed about before. The STUC have produced with Unison a really good paper in the last few months, highlighting some of the issues around outsourcing and not bringing services back in. Just quote a couple just to give some context. 16 billion is spent a year by the Scottish Government, Scottish councils on outsourcing, and between 2 and 3 billion of that goes to profit and other mechanisms that private companies use. Workers in outsourced roles are generally on suppressed wages, worse pensions, which hits the benefits bill in later life. So it's a bigger picture. So what we see, maybe on paper, is a more cost-effective service. I'm going to use the word cheap because the quality comes into it as well, and that's an important point to note. But nonetheless, we've got that situation. And from an equality point of view, services that are outsourced are generally staffed by women, low-paid women. Black workers are significantly underrepresented. And it seems that that policy choice of persistently outsourcing and the effect it has on pay and pensions on low-paid women in particular, we pursue to get services at the best possible cost and quality for this board and for the Health and Social Care Partnership, but it seems a bit counterproductive in a way. And I'm keen that we can perhaps record something formally. I note that obviously this plan is, or framework, as you're going to call it now, is up for approval today before the board. But there is a line in the background, 4.2, that requires the IJB to review that strategic plan every 3 years. And I would want to formally request that for a good, formal and honest look around insourcing is part of that consideration when that's reviewed in 3 years' time, if not possibly sooner. But it's an important point that we've brought as a staff side for the local authority over a number of years. And I think that's the time to perhaps make it more formal and bring it to the board today in terms of what we would like to see. There are fantastic examples. For a couple of the Ayrshire councils, NHS Lanarkshire recently brought back in all their cleaning and contracted services back into the hospital in Wishaw. Thank you.
Yeah, happy to respond to that, Chris. And I think we've been following the Ayrshire model since probably 2 years ago, maybe 2.5 years ago, and following that, and we are due to get an update at National Chief Officers around the impact of that. So that'll be interesting to see, and I'm happy to reach out to colleagues in NHS Lanarkshire around the approach that they've taken. Members will hopefully remember back in February time, we had a development session around looking at kind of how we were going to go forward, and one of the things that we are wanting to look at is our in-house service provision, both in terms of what we provide in-house from a cost efficiency saving, but actually how could we potentially look at a spend to save option around some of our in-house provision. Cindy's here and may want to talk about some of the work that we have progressed in terms of single point of contact, which has started to build a bit more in-house capacity, but I think there is an opportunity to develop that further. So happy to look at how we include something like that in our delivery plans for probably the care closer to home. Also covers prevention, proactive care as well. Happy to look at how we could include that. Although the framework is a 10-year framework, we do have a legislative requirement to review that on a 3-year basis. So that will happen anyway. I think the reason that we've taken a 10-year approach is because over the last 2 plans, nothing has fundamentally changed. So what will change for us is that kind of 3-year, and in fact, the 1 year at a time. What are we actually going to do so that we're starting to build and have the building blocks to develop and hopefully implement a 10-year vision and strategy. But Cindy, I don't know if you want to add anything. I know we've got a paper later on in the agenda where single point of contact is part of that paper, but Cindy might want to bring in something just now, Chris, if that's helpful.
Yeah, it is, Julie. Thank you. And it's something we've been passionate about. I think would be the best descriptive to use. But we've also got access to knowledge of how these programmes can work, and we would happily work with the partnership to aim to achieve that moving forward.
Thank you. Lewis.
Yeah, thank you, Chair. I fully agree with Chris and his statement and sentiments, and I think just in terms of openness and transparency, Chair, I actually had prepared an amendment for this agenda item, and I'll just very briefly, if that's okay with you, just read out the bullets of it. And it was to ask IGB officers to undertake a feasibility and options appraisal on our own health and social care controlled interventions that could reduce unmet need and stabilise complex care provision, amongst other things. And for the appraisal to include an evaluation of previous disinvestment decisions, such as the service redesign and reduction of our in-house health and social care officers, concierge, sheltered housing, again, across a number of areas of our business, to look to see if actually have we perhaps made reduced a reduction to make a saving, but actually it's had unintended consequences and perhaps is creating additional need and pressures elsewhere, and do we need to revisit that? So just very much what you've just said there. And also, I think for me, when I read this report, the best way to describe it, and I've maybe interpreted it wrong, is that we are in a crisis. The ship is sinking, and I know that everybody here that works within health and social care is trying so hard to keep it afloat, but it felt very much looking like we were then expecting everybody else to help us. rather than looking to see what perhaps we could do differently. And so I think, as Jill, you've said, if we can look to see where perhaps, rather than keeping on reducing, where can we perhaps invest and spend to save? So I've been advised, so the long and short of it is that I've been advised that this amendment would be better placed on agenda item number 15. But yeah, I just thought it was important to, I couldn't sit without burning away their chair. So I just wanted to say that, I'm acutely aware. Another area that I've not mentioned, but I did have within here, was a crisis response and complex in-house provision, and looking at our supported accommodation. We know, I mean, it very clearly says within the supported accommodation statistics and report that we have increased demand, but actually we're at full capacity with supported housing and little turnover. So, and I know from engaging with some groups out there, such as the South Angus Parent Carer Group for people with a learning disability, they're hugely concerned that actually there isn't much movement or perhaps even accommodation in places that would help keep people closer to home within Angus. So so I'm glad that I've been able to share that with everyone, and I will bring that up on later reports this afternoon.
Okay, thanks, Lois. I mean, the supported accommodation, I think it's a national challenge, isn't it, that nobody's really got a solution to yet. But any other? Yes, Alison, and then I've got Dave.
I'd just like to reflect that this strategic framework does represent opportunities to invest in prevention, which would hopefully keep people well, thus be less reliant on care services. So an example would be the investment in our programme around the life curve, and making sure that we are supporting people in their 50s, 60s when they start to deteriorate in function, and invest then, and there's some good outcomes in other areas. So I wouldn't want to get the impression that all our strategic plan is about people managing for themselves. It's empowering people to actually be healthy so that they don't deteriorate and demand it. It's absolutely not about stopping providing care. So just that would be quite key, I would think.
Sorry, apologies. That's not what I meant, and apologies if I didn't articulate that. What I was feeling and when I was reading was that we are looking to outsource to private providers, externally, to deliver our services, which has its place, absolutely. But when we have got an increase in demand and we've got unmet need, as an example, I don't think we should be looking to wait for other providers or other services to pick up, if that makes sense. Yeah.
Cindy.
I just wanted to reassure members that actually over the last six or 7 months, we have recruited an additional 350 hours of in-house care at home, plus I'm just waiting on the message on it to say how many hours of a mainstream service. We are now creating a mainstream service within our Home First service, because we realise that we want to be or have the ability to be a provider of last resort when there is no external agency available. So I think it's 300 hours of mainstream service plus 350 hours of an enablement service. So that's quite an increase in an in-house service that we've had over the last 6-7 months. Yeah.
Thanks, Cindy. And Dave, you were going to come.
It's just a direct question. They attached to the framework document, as Jill said, there's a number of appendices. The market facilitation statement, Appendix 5, which has its own appendix, which is current commissioning priorities. There is no reference in there to daycare services, which, given the conversation we've just had in that regard, concerns me slightly.
Thanks, Dave. So In terms of the provision of daycare, we've looked at that across day opportunities and daycare. So when we looked at the interim market facilitation statement this past year, we'd separated day opportunities and daycare following previous discussions within IJB going forward. So in essence, this is really a tool to make sure that we are delivering the right resources for commission services. So we're not going to go into absolute operational detail on every level in terms of what we're providing, but what I can assure is that any commission services, which would include day opportunities and daycare, would be undertaken through the use of the market facilitation statement. There's a number of other areas of commission services as well that won't be explicitly mentioned within the appendix paper here, because otherwise we just have a huge list of lots of providers. But any commission service will be undertaken through and facilitated by the market facilitation statement, including day opportunities and daycare. Thanks, Dave. Yes, Dave, you want to come back?
I mean, I take the point about referring, if you want to refer broadly to daycare and day opportunities together, that's fine. I would remain concerned that if there was no reference to either within the priorities, then if it's not a priority, then it's the first thing to fall off the table, and that's not what we would want to see. And if there's been work going on to try and resolve this for TCC, at least the last couple of years, then to me it is a priority to resolve it and be clear what we are actually going to commission going forward. So I would be unhappy to see no reference within the Appendix 1 of this.
Jill, do you want to come?
Yeah, I mean, I think John's point in relation to there's a number of services that we would end up having to list. And I guess the ask from us as officers of the partnership is for yourselves as board members to have that faith and that trust in us, that they are included within the overall work that we are taking forward, because it's a huge list if we were to explicitly name every single commission service that we would look to work to provide and with our commission providers. So I think the ask, I guess, is to have that faith and that trust in us that it is part of what we are doing and it is included in the market facilitation statement, albeit not specifically named. It is one of many.
Gemma.
Thank you, Chair. So I think it would be amiss for me not to come in on behalf of the independent sector following some of the comments today. I just want to come in and recognise the significant contribution of our independent sector providers in the area. We have some really skilled and dedicated teams that are operating here across Angus. In terms of Scottish Care's work, we're continuing to advocate in terms of staff pay and conditions at a national level and for ethical commissioning practices which will promote choice in person-led services. So I just feel that it's really important to highlight that, and also we would be really keen to be consulted in terms of any work that is ongoing in relation to looking at that change of provision. Thank you.
Okay, any other comments or questions? Are we happy to approve the recommendations per the report? Yeah, excellent. Okay, thank you. That moves us on to item 8, which is the financial plan 26, 27, 28, 29, and I'll hand over to Jane.
Thank you, Chair. This report is later than anticipated, and that's just due to the timing of our budget settlement approvals with our partners, which were agreed in May, if you all recall. This plan represents an update to the strategic financial plan that we presented to the IJB in February, and hence this report should be read alongside the previous report, as it contains only updated or new information, and it also reflects the agreed budget settlements and their impact of the partnership's financial position. It proposes the adoption of the 26-27 financial position as an interim financial planning framework, with the planned use of non-recurring savings and reserves to support the 9 million funding gap in 26-27, while longer-term sustainable solutions are developed and implemented. Noting that the finance report that's being presented next includes a recommendation that the partnership retains the 25-26 in-year operational underspend, and subject to approval, this has been reflected in the reserves position reported within this plan. This approach provides a short-term, non-recurring financial support and is not a financially sustainable solution for addressing the ongoing financial pressure. And that's very much detailed in section 7, in particular table 3, where you can see over the 3-year period the recurring gap of going up to 13.6 million. As such, the development of operational planned interventions is fundamental to addressing the underlying gap, along with looking at the transformation and reform framework. It is therefore recommended that a further report be brought back to the August IJB meeting, setting out the proposals to address 3.7 million funding gap, and that refers to the action log, in particular, one of the points there. Before I take questions, I'm going to pass you over to Jill at this point.
Thank you. Yeah, thanks, Jane. I think just to recognise that the plan has been quite challenging to do. I think everybody is aware of the real challenging position, and that is really reinforced by the Health and Social Care Scotland financial viability report as well across all IGBs, which is currently being considered at Chief Officer and Chief Finance Officer at national levels, and I'm fairly sure it will be at the Chairs and Vice Chairs meeting very soon. So just to give a level of assurance that we are involved from the kind of national financial viability perspective, but also just to recognise, and we raised it at Audit Committee this morning, the size and the scale of the challenge ahead of us. We can't do that on our own. We have to work with our partners across the system to be able to deliver what we need to deliver to have sustainable services, but also really achieve what we want to achieve around shifting that balance of care towards more community services, and that we have to see the shift of resource that goes alongside that. Thank you, Chair. Thanks, Jane.
Thanks, Jill. Yeah, I mean, it's not pleasant reading, seeing the financial position like that and effectively using one-offs to try and balance out 26, 27. I think it really is important. I think there's still the outstanding action, isn't there, to come back with the 4.5 million of savings. I think it would be useful as well if we can see what savings coming forward are recurring, so we can see they've got a positive impact in future years, and then obviously the non-recurring savings, it kind of strips it out. I mean, obviously the use of the reserves, it leaves the IJB in a pretty precarious financial position for 27-28, and no doubt the two directors of finance of our funding partners will be very much laser focused on us in terms of the decisions that we're taking over the course of this year, in terms of trying to demonstrate that we are going to get into a financial balanced position on a recurring basis. So appreciate all the work that goes into it, and I know how difficult you've got effectively increasing demand and decreasing financial resource to meet that demand, and it's not just Angus that has that challenge. Any questions? Yes, Lois.
Yeah, thank you. A couple of questions. I'll make them quick. In terms of our consultation for budget, I've asked this before, if there are any plans to do like a public consultation within Angus on our budget, especially given the increased pressure. So I'm just mindful that we are in June before we'll be back, and it'll be moving swiftly towards the end of the year, and then into budget time again. So these things do take a bit of planning. I appreciate that everybody's time will be tight, but is that something that we feel can be achieved this year?
Thank you, Lewis. Yes, that's certainly something that Jill and I have already spoken about. We're conscious we want to have a 6-week consultation for the public, and it's something that we would start to build in and work towards, particularly for the direction of travel going forward.
Again, just in terms of kind of possible budget kind of like realignments that might need to be made, for example, in terms of the true cost of daycare, and I'm just using that because it has been, it could be other services, it has been a live debate today, but it could be other services as well if there's a true cost needs to be given. Will we manage to do that? And if we do recognise that there might be a spend to save option, just get some assurances that we'll be able to deliver on that to meet our statutory duties.
So a couple of points there. We still have a reserve that allows us to do invest to save initiatives, and we would very much be supportive of that, and that would be approved through the strategic planning group. And we have used that in the past to do specific prevention work that's enabled to demonstrate things. So we've already set precedents around that, and that's something we would be very supportive to continue. With regard to the realignment and looking at the budgets, that's work that we've already started to progress in prior years, and we're still continuing to do that. And there's an element in the report that we talk about that in section 5.1.5. With regard to the unknown and the specific question that you've asked there, I think we'd have to wait to see what the information comes back and then look at the whole picture together. And it may be, depending on the outcome, it could be that we have to take resources from one area to feed another area, but very much that would be strategic, and those proposals would be brought back to the IGB for that decision making.
Yeah, no, that's a good point you raised there, Lois. And I've kind of seen that in other organisations where effectively you're a service is constantly running over budget because they just don't have the funding, and that's been realigned to give them the full funding. But then they get set a target of savings or efficiencies, whatever you want to call it, that they have to achieve, and they're starting from a cost-neutral base. So, in essence, the worst-case scenario is that they would break even for the year. But actually, what you're looking to do is try and challenge to get that service cost down. That was kind of the point I was making earlier about the recurring saving. I mean, we know that NHS, I mean, it's already been made quite clear that they're going to have to make 3% recurring efficiency savings year on year for the next 3 years. I'm going to be pretty surprised if that's not passported down to all 3 IJBs. I know that Angus Council has just had its GAEs, well, not just Angus, but GAEs have just all been recalculated, which are going to put pressure on Angus. So I think it is incumbent on us as an IJB to really get to grips with the kind of financial position and make sure we've got plans in place to start demonstrating how we can get ourselves into that financially sustainable position, albeit the challenges are just ridiculous. But as I say, it's about trying to get that balanced position across the whole piece, isn't it, between patient care, financial balance, and the kind of service levels that we provide. So but it's a good point. Yes, Jane.
If I could just come back and share, it was perhaps remiss of me to say, although this paper has been late in coming here, behind the scenes, the officers have been working and looking at planned interventions on a recurring basis, which we would then bring back, as I mentioned earlier, to the August. So there is work that is happening behind the scenes. I would also emphasise that we recognise there's always non-recurrent type things that will happen, but our focus as an executive management team is around the recurring. It's not about the non-recurring, because again, that's not a sustainable solution.
Okay, thank you. Yep. Lois, you want to come back?
Just clarity, are you going to bring back a report then after kind of summer recess, so in August, with regards to consultation and setting that out? Is that as to how that would look?
The August one's going to be around our planned interventions. But what we would then do, I think it would more likely be, we'll have to look at the timeline for that, if that's okay. So I wouldn't like to commit at this stage till we've done that.
Yeah. Okay, that's...
Okay, are we happy to approve the recommendations? Excellent, thank you. And that moves us on to item 9, which is the finance report. Back to yourself, Jane.
Thank you, Chair. Again, this report provides an update on the financial position of the AIJB for 25-26. Overall, the operational underspend is relatively similar to what we had previously reported in February time, which is around about the 2 million mark. I would highlight to members that at the February time, we were planning to deploy in-year underspends to our partner bodies. However, as we've already referred to earlier, the proposed budget settlements from our partners was different than our expectations, and subsequently, and following a development session which was held with the IGB members to consider the implications, within the paper we have the proposal that we now retain these operational underspends to support future years' financial shortfalls. I would also emphasise that we did engage with our two respective partners to ensure there was no detrimental impact on either party with doing that. And lastly, I would just want to two other things. One, Angus reserves do remain high compared to other IJBs. There's a number of IJBs that have no reserves now. And that, as we've spoken earlier in the last paper, does allow us that period of breathing space, so to speak, to allow us to develop and look at the reform and transformation. And a final point I would highlight is that this report focuses on the management accounting position, whereas our annual accounts focuses on the financial accounting position, and that is really the movement in and out of reserves. Okay. If there's any questions, Chair.
Thanks, Jane. It's pretty much in line with what you've been telling us for the last 6 months, so no real shocks. Any questions or happy to? Yes, Sam.
It was just on 5.1. The talk of it. There's the Scottish Government's 26-27 budget confirms additional primary care resource, which should alleviate some service risks. And I just wonder, if any, is that to more to do with premises?
Thank you, Sam. That's actually to do with independent practices where there's significant level of workforce funding going in. So there was a tranche of 15 million last year. This year there's further 45 million, if I recall correctly. There's also some further funding for expenses and further tranche. And this recognises the challenges that we have around the GP recruitment and retention within primary care, which is fundamental for the whole system. But I know Alison and Andrew may wish to add in something else there.
Yeah, it's roughly equivalent to around, for a large practice, having an extra GP. Right. So this is significant. And when we look at our primary care sustainability survey across Tayside, but in particular around Angus, we've got good evidence that we've got an improving position, although still high risk in many ways. We're in an improvement trajectory, so this is reducing our risks.
Yep, thank you. Thanks, Alison. I won't repeat that. So just in terms of the numbers, it's an additional 50 million this year, split into two tranches, 35 and 15. You can tell I've got my head in these contracts. There's also an additional 10 million across Scotland for expenses. Reimbursable for non-staff expenses. That's also investment into general practice this year. The overall package of investment that was agreed at the end of last year was 249 million that is realised at the end of the third year of this implementation, and we would hope that there's no backtracking on that commitment that's been made, because practices have been encouraged to think to the third year in terms of the total funding available, especially smaller practices, because larger practices there may be ability to recruit now, but for smaller practices it's fractions of a staff member that they could recruit now. So a lot of practices are actually investing over and above that money this year to be able to recruit, given the fact that the labour market is awash with adverts for GPs and ANPs, etc. I think this is a huge investment. I think the biggest downside of this is actually that the question that you started in terms of premises, that actually there is very limited money within this 249 million to support premises. There's a reinstigation of the sustainability loans for practices, which is the process by which health boards take on the ownership of a building incrementally through 20% interest-free loans over a period of 25 years, which have been paused for a significant amount of time, but there is no other capital allocation within this. And some of the biggest problems for our practices, both in Angus and wider, is that the intention of building in more GPs, more ANPs, more nursing time, etc., etc., etc. Where do you put these team members? And actually, for some, that means resorting to remote consulting, not face-to-face, and for a lot of patients, that's not an ideal situation and doesn't actually support, potentially can undermine continuity of care, and continuity of care is absolutely recognised as a key milestone to improve quality within general practice.
Thanks, Alison. Thanks, Andrew. Happy to... Yes, Chris.
Thanks. I'll wait patiently to the end. It's just a technical point on Appendix 2, page 53. The support and accommodation review is described as delivered in April 26 and complete. I don't think I find that is correct. That review is still ongoing. There's a further meeting taking place next week. Thank you.
Okay, we can take a note of that. Well spotted. Glad to see. Just checking, make sure everybody's read the reports, you see. That's all it is. Okay, so we're happy to approve the recommendations. Yep. Takes us on to item 10, Tayside Primary Care Foundational Strategy 26-28. Jill.
Thank you, Chair, and probably quite helpful that we've just had that discussion prior to this agenda item, so thank you for doing that, not deliberately. Primary care is absolutely the foundation of our health and social care system, and it delivers around or over 90% of all contacts, plays a critical role in prevention, community care-based and long-term care for individuals, and supports a real continuity of care for individuals. The Tayside Primary Care Foundational Strategy has been developed as part of an NHS Tayside corporate objective and provides for the first time a single strategic framework for primary care services across Tayside. It is in line with the National Direction of Travel. It covers all 4 independent contractors, which absolutely extends beyond general practice, so it includes community pharmacy, general dental services and community optometry services as well. Angus has the lead partner role for primary care services across Tayside, and our role is to coordinate the development of the strategy on behalf of all 3 IGBs and NHS Tayside. So the intention was deliberate around a 2-year foundational strategy focusing on stabilisation, workforce sustainability, strengthening governance and creating conditions for future transformation and shifting the balance of care. It aligns strongly with our IGB priorities, specifically around prevention, proactive care and care closer to home, as well as the wider NHS Tayside priorities. It has been developed through extensive engagement across the system. Many of people around this table have been involved to date. It has been considered and endorsed by NHS Tayside Board in April this year. It has gone through all 4 advisory committees with support. It has been to Area Clinical Forum, and similar to Dave, this is my 3rd IGB presenting this paper this morning, was approved at both Dundee and Perth and Kinross IGBs today as well. So hopefully that reflects a collective commitment across Tayside around how we're going to support and deliver primary care. So approval today will enable Angus IGB to formally adopt the strategy and issue the direction to NHS Tayside on behalf of all 3 IGBs, with the overseeing of delivery around this through the Primary Care Board. So happy to take any questions, and colleagues may want to come in terms of the input that we've had to date.
Any questions, comments? Sam?
No, it's just a comment. it's just great to see because obviously all the years have been involved to see it become a live document and hope now it can be utilised. The one that, it's not for questioning, but the shared records and digital interoperability, which we've talked about for years, it's just how that's going to be done will be a challenge, but that's for another day. But it's great to see the report. Thank you.
I think there was a question around data and digital at Perth from Perth and Kinross IGB, and it was also raised at Dundee IGB this morning. I think we absolutely recognise the importance around digital to support that. There's a number of different strands to that. There's the digital front door, which is part of the subnational work, but there's also the work that we've done locally around how we can link up services. So community pharmacy, for example, having access to a clinical portal, etc. We do what we can locally with the systems that we have, and we've got great digital and IT support locally around that, but absolutely recognise the importance around that, Sam.
Thanks. You kind of took my question away there, Sam. So, Andrew.
Not so much as a question as a comment, just a thank you for the development that's gone into this. It has been iterative, it has been developed, and feedback through every stage of this process has been incorporated within the document, and that's very much welcome from all of the sort of representative clinical the area clinical forum, which I was previously chair of. Certainly seen this on a number of occasions to be able to provide comment, and that's been very welcome. I think it will segue nicely into the national primary care strategy, and that's why it's sort of set out as a couple of year strategy here, because it will need to adopt, but I think actually this will lead the way rather than need to follow the national strategy when we get to that point.
Yep, thank you. Happy to approve the recommendations. Excellent. Okay, thank you. That moves us on to item 11, planning for 26/7, delivering improvements in unscheduled care, and that's yourself again, Jill.
Yeah, thank you. I'm just presenting this report on behalf of Lisa, who is actually at her son's graduation today, and she's got a lovely day for it, so congratulations to him. So this report provides an update on quite a significant amount of work that's been undertaken across Angus as part of the wider Tayside work to improve urgent and unscheduled care, and seeks approval from IGB to continue this approach into 26/27, which is absolutely in line with Scottish Government operational planning priorities. Members will be aware that improving access, patient flow and reducing hospital admissions where alternatives are available remain an absolute key national and local priority. Across 25 and 26, we have worked extremely closely with NHS Tayside acute colleagues and our other health and social care partnerships to develop that whole system approach focused on supporting more people to receive care closer to home, reduce delays and ultimately improve outcomes. This has included the establishment of our Home First model, expansion I'm going to say hospital at home because that's the national term, but Home First is what we're taking, and I believe that language is being used in other areas now as well. The development of the single point of contact, which Cindy has already referenced to, and investment in frailty services across Tayside to really support that discharge without delay. Important just to note that frailty is not an age thing. Frailty, thank you Chris for smiling, frailty covers all age groups. The report also highlights how additional funding was utilised to support and strengthen primary care capacity across Tayside, just as in February-March this year, and resulted in just shy of 18,000 additional GP appointments, which from an Angus perspective was roughly 5,000 additional appointments over that time period, which really helped us to manage that demand earlier and provide improved access to our GP services. So looking ahead, Scottish Government have been really clear that the focus for 26/27 is to continue to accelerate the work through improving access and flow, and that's also been driven through the subnational work, where we've got an all-day workshop on Monday coming up around that. Our work is aligned very strongly with that. In fact, I would argue that the national work is based on Tayside work and approach, which is also nice to see, but happy to take questions, Chair.
Thanks, Jill. Comments, questions? Chris.
Thanks. It links to something that's later on with the graphs about admission rate, which has gone up, which is across Tayside. Demand's gone up, that's fair enough. But our length of stay's gone down. That shows our flow's really, really good, and that's great. But it still suggests that we're very hospital-centric, and that our method of dealing with demand is to push through 9 wells and then get out quickly. And I suppose that does shift the balance of care somewhat, but if we're truly committed to shifting that balance of care, that's got to change fundamentally how we do things. But we're constrained by the budget that we have to be able to do that.
Okay, so Cindy will probably want to come in there as well. So our single point of contact is not just from the flow out of hospital, aiming to look at how we can look at supporting alternatives to admission. And Cindy's always asking for money, but Cindy, is there anything else that you want to add to that?
The Home First service is more focused on the prevention of admission, where our aim is to keep you out of hospital by thinking home first. So our service now has advanced nurse practitioners, community nurses, allied health professionals, enablement carers, MFE consultants, the Angus discharge team providing the social work function, and senior social care officers all working together in one place to prevent you going in. We do discharges as well. We bring people out quicker because we've got that wraparound service, but the majority of what we do is to stop you going in. We've had since January to May over 500 referrals, and that's a mixture of people coming out of hospital but also social workers, GPs trying to prevent an admission in, where we can wrap around the person, try and get a care package in, community alarm. We have worked really, really hard. Our average length of stay is down, so that people are coming out, and our readmission rate is down as well for 7-day and 28-day discharges. So that is for Angus, that is down as well. So I think we're getting something right. It's just about consolidating it and taking it forward now to over next winter to make sure it is working.
Okay, no other questions. Just a quick one from me. In terms of the subnational, we keep talking about the subnational. What role does the IJB play in this subnational programme?
Okay, so IJBs do have a role because we are meant to be the commissioners of services. It's been a topic of conversation at the subnational meetings. Chief officers have now been involved in their rights as an IJB chief officer and invited along to the meeting. So we're working very closely with the Lothian or the East team, of which Tayside is part of, around how do we ensure that IJBs do have that role, and that the awareness of the role of the IJBs is considered as part of the subnational planning. I did take a report to Strategic Planning Group on the implications for us. Happy to bring a report back to IJB if that would be helpful for noting. So we do have a role. We're currently just working that through.
Okay, no, thanks for that. And I definitely wouldn't mind a report for noting, just to keep us in the loop. Happy to approve the recommendations. Item 11, good. Item 12, the Angus Health and Social Care Partnership, Social Work and Social Care Governance Framework. And is that yourself again, John?
Thank you, Chair. Yeah, I'm really pleased to bring this paper to IJB today and present the Social Work and Social Care Governance Framework for approval. This is a really positive development for us as a partnership. So the purpose of the framework is to provide a structure and also a governance approach that is consistently applied across the partnership. And the purpose behind it is to provide the IJB, Jill as Chief Officer, Angus Council and Kirsty as Chief Social Work Officer, assurance on the delegated social work and social care statutory duties and practice across the partnership. So we've not started from nothing. We have built on a strong existing arrangement through the partnership's clinical care and professional governance processes that are well embedded, but it ensures that we have clear and effective social work and social care practice across the partnership. evidences service user experience and outcomes, ensures governance and accountability of statutory social work and social care practice, develops quality improvement and learning opportunities for staff, and then through that ensuring that we have a competent and professional workforce. The framework does have a clear link to the IGB Strategic Commissioning Framework as well, and is a further driver for us in delivering safe, effective and sustainable integrated services. It's important to note too that the framework will also report wider than IGB, but through Angus Council, Family Education and Justice Committee and the Scrutiny and Audit Committee, respectively. So members will note the 4 recommendations contained within the report, and obviously the appendix attached is the proposed framework. So happy to take any questions or comments. Thank you.
Any questions? I had a couple. It talks about it was 6.5, I think. Yeah, in 6.5. It talks about a consistent approach to evidencing assurance is established through audit and review activity. And I just wondered, when it talks about audit, is that internal audit, external audit, or is that just officers within the team doing an audit? Or it was just to get a bit more understanding of that. And the other question was on the ADP 90-day review. How far through are we on that?
Okay, in terms of, I'll pick up the 90-day review on a subsequent paper, actually, Chair, so if that's okay to pick that up there. In relation to audit, yep, you're absolutely right. It's a combination of internal audits. So we currently undertake audits around adult support and protection and adults with incapacity work regularly through the teams every month on a rotation. There's further opportunities to develop those auditing processes further. We want to pick up on practice issues. We want to look at where there's the need for escalation at certain points in time as well, and all those have formed part of discussions that we've had even this morning in our social work leadership meetings. So the auditing work also will be supported by our own internal and external auditing as well. So it's a fairly robust system, and we currently have reporting through our clinical care and professional governance around our auditing work as well. So it's really building on those existing good bits of practice that we have.
No other questions? Happy to approve. Lois, apologies.
Sorry, thank you. Yeah, I just thought I'd take the opportunity on this report just to ask around kind of transition kind of work and planning. I know that in the past, sometimes the barriers are just because like children and young people services sit, you know, under one umbrella of governance, and then adult services is another. Do you think there will be enough flexibility within this in terms of being able to be as creative and as flexible as possible with transition fund investment, so that we can really look to do much better in terms of, yeah, young to adult services? Does that make sense? Because obviously, if some of the barriers are in terms of our reporting and where budgets sit, is this going to enable like that flexibility?
I'm happy to pick that one up. So I think we're maybe confusing two different. So this is around the quality of care that we're providing from a social work governance perspective. So I think transitions will play into that in terms of how and what we're delivering. The actual transition funding won't really play a part in the governance framework. So I'm not really understanding your question.
I'm just, yeah, sorry, yeah, take the funding bit away from it, but I'm just, in terms of work and reporting, there could be an individual or a family that's moving, and we're going to do a bit of work creatively where it's not about who's holding the budget, but when it comes to reporting, does that tie anything down?
Thanks, Lois. So this also links to Kirsty Lee, as the Chief Social Work Officer, has a scheme of delegation as well built in, and our governance framework really supports and mirrors the Chief Social Work Officer framework. So I suppose what I would say to that is what it does is it aligns and makes sure that the opportunities of us working together in partnership, making sure there's consistent social work practice. So how we practice would absolutely influence the transitional work going forward and ensure that we have a collegiate and a consistent way of working. The operational matters will sit beneath those frameworks, and that's where Steve's point around auditing will come in. We'll be able to audit certain areas at certain points in time to feed that through the governance process. So as it's fed back and as it's developed, it may well be that there's direction for us to consider certain elements that we can audit to see how our practice is developing. So the framework would support work around that.
Yeah, okay. Thanks.
I think just to enhance that, because we're going to be taking reports through family education and justice, we'll be working really closely with children and families as well.
Okay, happy to approve the recommendations. Okay, thank you, John. That moves us on to item 13, Angus Alcohol and Drug Partnership Update. Actually, that's where my ADP 90 question come in. I've just taken the number down wrong, so apologies for that. Is that yourself, Jill, or John again?
Thanks, Chair. Yeah, you caught me off guard there on that one. I thought, oh. So, yeah, absolutely. The purpose of the update report to IGB today is to seek approval and support of Angus ADP 90-day rapid review, and that is in response to the National Drug and Alcohol Strategy that was launched this year on the 10th of March. So the national strategy has a revised partnership delivery framework for ADPs to establish a clear position and identify actions from this framework. As an ADP in Angus, we have initiated a 90-day review. This 90-day review was something that was set out as best practice within the partnership delivery framework. So the ADP lead officer, Nikki McNamee, who's joined us on Teams today, is progressing this review alongside partners, and this will conclude at the end of July this year with a development session planned for September, of which the ADP would very much welcome attendance and input from IGB members as part of that process. So within the report, members will note progress across various areas, including funding and commissioning, self-assessment and embedding lived experience within our ADP work. And I have to say that's an area that we're doing really, really well in. There's been some excellent practice and excellent examples across services in Angus around how we embed that going forward. So at this stage of the 90-day review, the ADP is proposing a reasonable level of assurance to the IGB. Members will note the 3 recommendations contained within the report. And I'm pleased that Karen Melville is with us, as well as Nikki McNamee, who's our lead officer within the ADP. So we're happy to take any questions you may have. Thank you.
Thanks, John. Any questions, comments? Lois?
Yeah, thank you. Just a comment to say that, yeah, I've seen a lot of this work in action and a lot of hard work going on in our communities to support individuals and families. So, yeah, just really wanted to put that on record and give my appreciation for the work that goes on here.
Yeah, thank you for that, Lois. And it's good to see that everything's on track as well. So I always like to see ambers and greens. That's always my favourite. Although tart and blue tonight, obviously. Are we happy to approve the recommendations? Yep, okay. That takes us on to item 14, Angus Alcohol and Drug Partnership Annual Reporting Survey. Back to yourself again, John.
Thank you, Chair. So the purpose of this report is to provide information to the IGB in the 2025-26 Scottish Government Annual Reporting Survey for Angus ADP. You'll note within the report that we're proposing a reasonable level of assurance against national priorities. The survey is really a strategic tool to monitor and assess local and national progress. It does help shape national policy, but it's of relevance locally as well because it enables us to develop local benchmarking and support future developments for the ADP. So the report does highlight progress across a number of areas, and as has been touched on already, and noting Lois's comments too, especially in engagement with those of lived or living experience, and just to reiterate that we're performing really strongly in that area, and that's often one of the hardest areas to work well in. There are areas for further development, and that does include tackling alcohol harms, expanding awareness raising and consideration around our workforce learning and development. In the report, you'll note that in previous years, the annual reporting survey has required approval from IJB. However, the new National Partner Delivery Framework, which I referenced in the previous report, notes that approval from Angus ADP Strategic Committee only is where the approval sits, and I can advise that this has been approved by the ADP in Angus on the 9th of June this year. So members will note the 2 recommendations contained within the report, and again, myself, Nikki or Karen are happy to comment or answer any questions. Thank you.
Yes, Sam.
John, thanks. John, my question was, do you ever get any feedback on when it's submitted, or is it just it's acknowledged and that's it, or do you get feedback on what you've put in?
Thank you, Sam. There's a novel idea. I think Nikki's probably best placed to answer this. I see Nikki's just popped up on the screen. So, Nikki, can I invite you just to provide a bit of a comment around that, please?
Sure. Thanks, John. I think historically this has been an ask from ADPs and especially from ADP lead officers that, you know, there's an effort goes into completing these surveys from not just us but partners and things. And I think we've had some feedback on a Scotland-wide level, but feedback to individual ADPs is not something that we've really received and something that we continue to ask for.
Thanks, Nikki. I mean, my question is kind of similar to Sam's. I mean, is there any kind of output from this that sort of says, you know, have you looked, you know, we've now done the survey across Scotland and this is like a really exemplar methodology or something, you know, is there any of that kind of thing? It just seems to me like you're just completing a survey for completing a survey's sake.
Thanks, Chair. I'll provide comment, and Nikki or Karen, feel free to jump in. I think the general trajectory is moving much more towards autonomy for local ADPs. So the recent framework, the national framework and associated papers around that are really putting much more onus on ADPs to develop their work around what their own local needs are. So in Angus, we obviously have different needs to the likes of Glasgow or Edinburgh. And that's where some of our challenges have been in the past, because a lot of the national strategic directions have been probably felt quite central Scotland-ish, and we've had to design and develop systems to make it work for Angus. So in lots of ways, it's positive to have more autonomy. I think it would be helpful to have at points in time direction and assistance. We did have an ADP development session this year, and it was really positive to note that we did have senior civil servants from the Scottish Government attend and really listen to us, hear what the needs were, hear how we are working in Angus, and that probably helped shape some of the national framework decision making around more autonomy to ADPs as well. So I think more autonomy, helpful. More guidance at points in time would also be helpful. But Nikki or Karen, feel free to add anything that you think would be valuable to that.
Probably the only thing to add is within the, as you said, John, within the partnership delivery framework, and as part of the 90-day review, there's self-assessment tools for ADPs to use to kind of measure themselves against areas contained within that. And that's something that we will be progressing with as part of the review. So that might be helpful, more so, if you like, in terms, well, more so as opposed to the survey at this stage, I think, for us locally.
Okay, thank you. Karen.
Yeah, and just to add a bit further, I think the development session that we did have when Scottish Government attended was really, really useful, because I think, for one, we wanted to know we weren't out of kilter with the rest of Scotland by saying this is our population need, this is how we as drug and alcohol services working alongside our partners need to change and develop and train and utilise our money and resources differently to help meet the need of the population, because we've got a change in cohort and we've been watching it for some time. So when you think about it from a governance perspective, that horizon scanning, all of our resources were around MAT, like the medically assisted treatment model. We needed to be able to shift and change that around meeting the needs of younger people affected by ketamine. The increase in alcohol referrals and late alcohol referrals when people already have quite advanced physical issues or mental health issues associated with their substance use. And we got really, really positive feedback from Scottish Government. So I think we welcome the new strategies that have come out now. It's much more akin to how we want to work with people in Angus from a person-centred perspective. And they really liked what we were trying to do, our finance and commissioning, to really look at where we might have pockets or areas where we'd want to disinvest and reinvest, which I think actually fits in with Lois's comments earlier around showing that we're moving our resources and our funding to try and help meet the needs of the people affected by substance use and their families and communities, actually.
Okay, thank you for all of that. Yeah, Lois.
Yeah, thank you. Yeah, just in terms of both these reports, but kind of the work that goes on behind it. I mean, I see a lot of the correspondence, not always interacting with it. It probably is more for operational, but it provides an insight into the amount of work that does go on. But on the whole, I think what has really encouraged me over the last year or two in particular has been that greater engagement with those with lived experience. And I really do see quite a kind of move there and a shift. And I think it's really encouraging to see those family members who are impacted because of their loved ones' addiction and really being able to share that and highlight where the challenges and barriers are. But also they're facilitating their own groups to support others. And I think in doing so, they're helping break that stigma as well. So hopefully, all in all, I mean, I certainly feel that Angus is definitely pushing on this agenda to be out there doing as well as anybody else, which I think is, yeah, it is positive.
Yeah, no, that's really positive. Okay, we're happy to approve the recommendations. Yep. Okay, excellent, thank you. That moves us on to item 16, Clinical Care and Professional Governance Assurance Report. And that's your... Oh, sorry if I jumped. Yeah, do you want us to stop for a comfort break, everybody, or...?
What, a 10-minute?
10 minutes, yeah.
Can we pause the live stream, please?
That's us. Hello, welcome back everyone. A little hydration break there for us, so keep the theme going. I've got the salmon pink on as well, just in case it's that they wear tonight. Okay, so that moves us on to item 15, Social Care Plan Procurement and Commissioning Service Implementation Plan, and I think it's over to yourself, John.
Thank you very much, Chair. Okay, so the purpose of this report is to provide an update on the progress of the implementation of the plan, which covers 2025 to 26, and a proposal to develop an updated commissioning implementation plan for 26-27 to come to IJB in August. So as noted within the report, IJB can take a reasonable but qualified level of assurance that the plan is being delivered, with demonstrable progress contained within the table in Appendix 1. We do note that there are some actions that remain in progress, but it does cover a number of details of achievements so far in terms of efficiencies, but also the rollout and testing of Pinpoint, our care workator tool, and other areas as well. It does also, I think it needs to be recognised within the context of our current financial and workforce pressures too. But before kind of taking any comments or questions, I'm just going to hand over to Jill in terms of the recommendations within the report. Thank you.
Thank you, John. Chair, just in terms of recommendation 3, we would like to put forward an updated recommendation. I'm happy to read it out to IJB members for support. So we would like item 3 to read: the Integration Joint Board is asked to approve the development of a refreshed strategic framework, strategic commission and implementation plan for 26-27, and request that a draft plan be presented to the board in August 26 for consideration and approval. The refreshed plan should set out the key commissioning priorities, delivery actions and intended outcomes for 26-27, and include a review of in-house service provision and supported accommodation to ensure services continue to meet current and future population needs, support strategic priorities by looking at spend to save options, as well as achieving efficiencies where possible. Thank you, Chair.
Thanks, John. Thanks, Jill. Do we have any comments or questions? Lois?
Yeah, thank you very much. Yeah, I just really want to put on record my thanks to Jill and to officers for agreeing to incorporate what was my original amendment and directing me to this report and agreeing to include it within a change to these recommendations. I think it really is a positive way forward to just think outside of looking at, I guess, constant cutting of services, but to revisit a few areas and to look to see where actually there might be an opportunity to invest and spend in-house as well. So thank you very much, everyone.
Thanks for that, Lois. And a useful addition to the recommendation, so appreciate that. Everyone content with the recommendations as well as the one that Jill read out? Happy with that? Yep. Excellent. Brilliant. Thank you. So that does take us on now to item 16, Clinical Care and Professional Governance Assurance Report. And it's yourself again, Jill.
Thank you, Chair. I'm actually just going to hand over to Alison, who's going to present the report.
So this report is presented and it gives an outline of the arrangements we have for monitoring clinical care and professional governance and seeking assurance from all our services. We continue with an integrated approach. We've heard of the strengthening social work assurance that is aligned with the framework, and we have the clinical governance framework from NHS side. Our teams continue to value our integrated approach. I won't repeat what's in the report. We continue to report to CG QAM, which is the Clinical Governance Forum in NHS side, and the report receives reasonable assurance, and a further report that was discussed today was similar, so reasonable assurance. So hopefully that gives the IJB some assurance regarding our activities.
Thank you, Alison. Again, any comments? Are we happy to approve the recommendations? Yep, approve the recommendations. Brilliant, thank you. We've obviously covered item 17, so that takes us on to item 18, which is the annual performance dashboard for 25-26. And John again, please.
Thank you, Chair. So this report provides the IGB with an overview of performance across Angus Health and Social Care Partnership. It builds on previous performance reporting to IGB and it draws on both national and local indicators. It does link very closely to our own strategic commissioning plan for 2023 to 26. And in some senses, there should be no surprises here as the strategic planning group reports to IGB and this is discussed through our SPG. So the IGB has agreed to progress the development of an audit risk and performance committee and in the future going forward a more detailed scrutiny of performance will be undertaken through this committee, which should help dig that a little bit deeper. But the report does highlight that performance is stable across our service areas. There is, I think it is important to note the context of continued pressures that we've discussed already today across the wider health and social care sector. We've touched on finance and workforce and increasing needs as well. But Angus does perform well across many national averages with better performance across 7 of the 9 qualitative indicators contained within the report. I'm going to pass over to Abby, who is just going to touch on some of the future plans and further improvements in relation to this work. So Abby, if I could just hand over to you before we consider recommendations and questions. Thank you.
Thanks, John. So I think, as John has said, we have seen some positive progress across some of the key areas, especially thinking about future care plan and Home First, as Cindy was talking about earlier, and some of those community-based approaches, which we're starting to see the impact of that against some of our priorities in terms of prevention and proactive care and care closer to home. I think moving forward and with the change in structure of the audit committee to audit risk and performance, I think it gives us an opportunity to sort of look at our approach a little bit different, to get a bit more of an understanding on the story behind the data, not just what has changed, but why. And during 26-27, we will strengthen our approach in terms of that performance and assurance through a deeper analysis, improved trend reporting, and clear links between performance, risk, and improvement activity. And I think the focus changing from the activity to the impact. So what does it mean for the people of Angus? What does it mean for our services? And not just looking at the traditional sort of RAG status, but understanding a bit more around the impact, as I said, with a stronger focus on those outcomes, variation, the risk, and then linking that to our improvement plans. Thank you.
Thanks, Abby. So we're, Chair, obviously happy to take any comments or questions in relation to this report. Thank you.
Do you have any questions, comments? Yes, sorry, Dave.
Just a brief comment. I think the move to what has been described by Abby and John is something I would welcome. I have the greatest difficulty sitting as I'm doing this now, looking at the page, which is all green, when in fact all the numbers have gone down the way over five years. And it just, visually it creates a totally wrong impression. And I think the fact that the audit and the risk committee will explore that in some detail in terms of what is actually happening, and yes, that presumably then would get summarised when it's presented here, is greatly welcome. Thank you for that.
Good. Thanks, Dave. Yeah, I kind of had a similar sort of question, just in terms of the colour scoring. So if you take percentage of adults supported at home who agree that they've had a say in how their help, care or support was provided, it's gone from 82% in 1920 down to 56.8, but it's still shown as green. So what is the kind of basis of the RAG status when we see that kind of trend, as Dave kind of sort of said?
Thanks, Chair. I'll come in on that, and maybe Abby can come in with some further comments as well. So I think it's important to obviously note against the national comparator below it. So, you know, we note that taking that example, Chair, you know, has obviously moved down nationally as well as it has locally. So whilst you're absolutely right to kind of pick up on that, and we can say it doesn't feel right sometimes when we see the numbers moving in that direction, but it's obviously taken account of what is happening nationally, so very much a national picture. But as we've touched on already, as we are able to delve a little bit deeper into this, I think probably the bit that we want to see, or imagine members will want to see, is the so what. So what we're doing, what are the actions that we're taking locally to address and try and seek improvement regardless of what the national figure shows. But Abby, I don't know if you want to add anything to that.
Yeah, so as John said, the RAG status very much focuses on where we sit in relation to the national average. So if we're better than the national average, then we're green. If we're equal to or within 5%, it sits at amber. And if we're worse, so more than 5% than the national average, then it sits at red. Just because we're better than the national average doesn't mean that's necessarily good, and that's something we have recognised. And I think looking at our performance indicators and aligning those to our priorities will help us understand where we've got sort of the outcome measure versus the process measures and the measures that we are delivering as part of service. We'll be able to start to understand that journey a little bit more and the impact on the individual as a result of that, rather than this sort of blunt tool that we currently have.
Yeah, I mean, I definitely think that's something for the audit committee to explore in a bit more detail. I mean, I can see the explanation and I see how that makes sense. But my concern is that it's a downward trajectory and we almost get ourselves into a position where we're suddenly having to then do something radically different to try and pull ourselves back up. So it's just trying to understand that trend. Lois, were you trying to come in there?
Yeah, thank you. Yeah, I think I'd asked similar before and was aware that, yeah, in terms of the national average, and that's how it looks the way it does. I think it is really positive and really encouraging when we have the service user stories. However, I guess I'd be hoping when the feedback is being gathered, not just through a survey, but I guess listening to those who perhaps do have, for example, unmet need, or whose journey through whatever service hasn't been as good. And I know that that might be difficult for them to come along, and I'm not looking to kind of bring a kind of optimistic doom and gloom approach, but I do think that hearing those not so positive stories and being able to use that to shape plans for the way forward would be really helpful too. Like I say, it is always encouraging and to hear a good news story, but I think just to get that balance right and to help then look to see how we can make those not so good, where people aren't agreeing that things are okay, to inform us to move forward and how we can get things right for the future.
Jill.
Yeah, thank you. I think a really helpful point. So I think in terms of complaints, concerns we receive, we will do kind of learning summaries, etc. What we could do is a bit of a different kind of service story, is provide kind of some of the themes and some of the actions that we've taken as a result of those, whether it be complaints or concerns that individuals have raised across the partnership. Happy to do that and bring a slightly different kind of perspective to service user stories, so that we can demonstrate how we are using the feedback to inform any improvements that we need to make.
Yeah, thank you. Like I say, I know that behind a poor experience and story, there will, there will often be like a team that's worked really hard, and just for whatever reason, it just unfortunately is the way it is. So it's not to make it look like people aren't doing a good job, or that teams are underperforming. But I think it would just help bring a balance, but also just keep it real and keep, not that I'm saying people need motivated to strive for us to do better, but just encourage that ongoing creative inward looking at what we can do differently and better.
Yeah, I think that's a really good point, isn't it, Lois? I think what we're looking for as a board or a committee is the assurance that that learning is embedded, because it's invariably, you know, not everything's going to go absolutely perfect. So it's just getting that assurance that you've got the learning in place so that we can see that we're actually improving, continuously improving through that education. So I think that's a good point. Alison, you had your hand.
Thank you, Chair. So looking at the performance around our use of bed days, consistently Angus over the last several years has performed better comparison to the Tayside average, and we do have similar hospital at home type approaches. What is different about Angus is that we have enhanced community support, which our multidisciplinary teams are really focused around general practice, and that is the thing that makes consistent gains. And I would be very keen that we continue to make the marginal gains and improvement around our unscheduled care performance, recognising, particularly in measures such as spending the proportion of time in the last 6 months of life at home or a homely setting, that we maintain that performance through these integrated multidisciplinary teams and don't lose that. I think there's a balance to be had. You can see the improvement in positive experience of care with GPs. That is a wide public survey, so that will measure access from the perspective of your average Joe public, rather than the people that Lois is talking about who maybe have a higher level of need. And there is a bit of a tension between, do we provide access to the many compared to do we focus on those that are most at need and address our social disadvantage and our harder to reach communities. So I think it has to be nuanced how we look at performance. We need to get in among the different areas of Angus geographically, think about equity, but we must, from my perspective, from a clinical perspective, maintain what it is that has been working and so good in Angus over the years, and marginal gains, and really not letting up on the prevention and proactive care focus, because it does tend to be, when we're looking at the national indicators, a lot of things around access, activity and scheduled care. We need to maintain that balance of performance.
Yeah, no, good point, Alison. Any other questions? Happy to approve the recommendations? Item 18, excellent, okay. And that takes us on to the item 19, out of hours model of care option appraisal outcome. Take yourself, Jill.
Thank you, Chair. So this report is an assurance report brought back to IJB to provide a level of reasonable assurance around the progress that we have made in response to the approval of the out-of-hours strategy back in December 25. As lead partner, again, for out-of-hours, we have overseen quite a comprehensive programme of work, which has included, I am going to say, significant stakeholder engagement again, and it's actually from a Healthcare Improvement Scotland perspective been held up as a really good piece of work, and in terms of standards around engagement with both stakeholders and staff. We have undertaken significant tests of change and workforce and financial modelling through a structured options appraisal process, which has involved clinical, operational representatives from all three health and social care partnership areas, NHS Tayside, as well as NHS 24 and Scottish Ambulance Service, and our public partner representatives. So the report demonstrates a robust, transparent and evidence-based process which has been followed to identify a preferred future model of care which seeks to balance local access, quality and safety, workforce sustainability, affordability and operational resilience. Importantly, I think just to note, this isn't the end of a journey, but a bit of a milestone from an out-of-hours perspective, but also within the wider programme of work around urgent and unscheduled care, including service optimisation and shifting the balance of care across Tayside. So the key ask for the board today is to take assurance from the progress made to date, note the outcomes of the options appraisal and be satisfied that a reasonable level of assurance can be provided that the reform programme remains on track, is progressing through appropriate governance arrangements and is now moving to the next phase of detailed implementation planning. Thank you, Chair.
Thanks, Jill. Any comments, observations, questions? I had one question, Jill, which was around the kind of financials. I think the financial is just looking at the current cost of service versus proposed cost of service. But obviously the new service is likely to take demand out of other areas of the system. And was that kind of covered in the options appraisal, and how was it kind of covered? Because I couldn't quite follow it, sorry.
So we did do a full financial appraisal on it. There was 7 options in the long list. That was then through stakeholder and quite a significant panel of around 30 people. Got that down to 3 options which were scored, and then a financial appraisal was done on those options. And I'll just bring Jane in just around those the financials.
Thank you, Chair. So as part of that option appraisal process, when we got it down to the 3 shortlisted, we did an individual costed each for the spend profile. So in this paper, what we talk about is the actual expenditure, the cost of the service. And we've done that because in our strategic financial plan, we spoke about the additional cost, and we recognised that in our plan. So we'd made reference to it in the February time, and we again have updated it, and it's captured in the plan earlier today.
Yeah, thanks, Jane. Just to add to that, in terms of impact and opportunities, so whilst we've described what the current preferred model would cost, there is absolutely, we know that a robust, urgent and scheduled care pathway, which includes out of hours, supports the wider system in terms of attendances at ED and admissions to hospital. The data that we have specifically around a couple of the tests of change demonstrate some of that impact, and what we would be looking to do is proceed with the preferred option, but as part of the ongoing work through the Urgent and Unscheduled Care Board to look at how we can either further improve. That may be looking at a shift of resource, because we have actually it's resulted in a significant reduction of attendances, whether that be at Ninewells or Perth Royal Infirmary. So we will look at a financial framework to support the impact from an acute perspective, and hopefully, if we can demonstrate that well, that could result in a shift of some resource. But at the moment, in terms of our current funding plan, we need to be able to develop that sustainable service.
Yeah, I think that was the point I was trying to make there, was just looking at the whole system. You know, this is obviously going to have an impact elsewhere in the system, which it was just really how we kind of see that through a KPI or something. So, but that's fine. No other questions? Happy to approve the recommendations? Excellent. Okay, thank you. Okay, so that takes us to the close of the meeting. The date of the next meeting of the Angus Integration Joint Board will be held on Wednesday, the 26th of August, 26 at 2 p.m. And that ends the open session.
Can we stop the live?